Have you ever noticed subtle yet inexplicable changes in your loved one over the past year? Many people think that old age comes and goes suddenly, but in fact, the body often sends out subtle signals very early on, possibly months, even years before they enter the final stages of life. Unfortunately, these signs are often too subtle to notice at first. Only when we look back do we suddenly realize that they have appeared for a long time, but by then, it may be too late to prepare to fully appreciate each remaining moment. Today, we will talk about 5 important signs that can help you recognize early and be better prepared, both mentally and practically. Some changes you may have noticed but thought were just a natural consequence of aging. Some others may seem very small, but in fact they reflect the gradual weakening of the body. Knowing these things in advance will help you not only take better care of your loved one, but also give them all your love, so that their final moments are filled with warmth, peace, and meaning. The first sign, significant weight loss. This can be one of the earliest signs that your loved one's body is gradually entering a transitional phase. At first, it may not be obvious. The belt suddenly becomes looser, clothes seem looser, or simply the feeling of not eating as well as before. Many families often ignore it, thinking it is just a normal part of aging. But the truth is, when weight loss occurs without any apparent reason, it can be a sign that the body is no longer absorbing nutrients effectively. Muscles gradually decline, strength is lost, and important functions begin to slow down. It's natural for everyone to age, but if the weight loss is rapid, it may reflect a deeper change in the body. Your loved one may start eating less not only because their appetite has changed, but also because their body no longer feels hungry the way it used to. Food no longer appeals to them, their sense of taste fades, and their meals become smaller. This isn't simply a personal preference, but a physiological response, as if the body is slowly preparing for a larger transformation. Sometimes, weight loss is related to underlying health problems that we may not be aware of. Chronic illnesses such as cancer, heart failure, kidney disease, or even depression and cognitive decline can all lead to poor eating and weight loss. When the body no longer receives enough energy to sustain itself, it begins a downward spiral, and when that happens, no matter how much the family tries to encourage, prepare favorite dishes or supplement nutrition, the weight continues to drop. At this point, the most important thing is not to force your loved one to eat more, but to help them feel comfortable with light, easy-to-digest dishes, and especially to maintain peace in the remaining days. If you notice that your loved one is losing a significant amount of weight, be gentle, pay attention, and don't hesitate to seek medical help. Understanding what's going on will help you avoid surprises, allowing you to take advantage of the precious time to love and care for them in the most meaningful way. If you notice that your loved one is eating less, becoming weaker, or seems to have less energy to do daily activities, this could be an important sign that their body is trying to tell you this is not just a change in appearance, but also the body's way of gradually adapting to what's coming. Understanding these signs will not only help you prepare better, but also give you the opportunity to spend meaningful moments with them. One of the most obvious changes during this period is prolonged fatigue, but it's not just a feeling of tiredness after a long day. It's a deep exhaustion that doesn't go away even with adequate rest. Little things like getting out of bed, walking around the house, or even having a conversation can become a huge challenge. You may notice them sleeping more, needing naps during the day, and seeming lethargic all the time. It's heartbreaking to see someone who was once strong and independent feel helpless, even disappointed in themselves. They may withdraw, avoid conversations, or lose interest in things they used to love. But the most important thing is not to force them to do something, but to make them feel understood and loved. In these moments, your presence is the most precious thing. A gentle handshake, a warm word, or simply sitting together in silence can bring peace. Cherish these days, because the most important thing is not how much they can do, but that they feel safe and loved at the end of the journey. Now that we've covered the signs of chronic fatigue and how it affects your physical and mental health, there's another important aspect to look out for: changes in cognition and mood. As a person enters the final stages of life, not only the body but also the mind undergoes significant changes. You may notice that a once vibrant, energetic person begins to have difficulty following conversations, becomes disoriented even in familiar places, or forgets important details like the names of loved ones or recent events. This is more than just age-related memory loss. The brain, like every organ, requires a steady supply of oxygen and nutrients to function. When blood flow is reduced, there is less oxygen reaching the brain, leading to cognitive decline. Some people may have brief moments of clarity, followed by confusion or loss of connection to reality. Not only that, they also tend to withdraw. Conversations can become tiring, background noise can be annoying, and they may gradually choose to be quiet, lost in their own world. This doesn't mean they don't care about their loved ones anymore, but that their brains no longer process social interactions in the same way. You may also notice emotional changes. Some people become irritable, anxious, or easily frustrated, while others seem strangely calm, as if they have let go of everything. For families, this is a difficult time because it feels like they've lost their loved one even when they're still there, but it's important to remember that these changes are not within their control. Rather than trying to force them into conversations or remind them of reality, the best thing you can do is be there, gently reassure them, and create a peaceful space. Even if they are not as responsive as they used to be, they can still feel your love and presence. As the body begins to weaken, one of the most obvious signs is that the immune system becomes less effective. You may notice that your loved one is more susceptible to infections, even minor cuts or the common cold, but takes a long time to recover. This is a sign that the body is no longer able to fight off illness as well as it once did. As a person enters the final stages of life, not only does their cognition and mood change, but their ability to heal also declines significantly. They may have rarely been sick before, but now even minor illnesses such as colds, flu, or minor infections become more frequent and last longer. Simple injuries such as small cuts or bruises that would normally heal quickly now take longer or do not heal at all. This is not a coincidence, but a clear sign that the body has lost its ability to heal itself. One of the biggest concerns is recurring infections. Pneumonia, urinary tract infections, skin infections, and even mouth infections appear with increasing frequency, becoming a huge burden for both the patient and their family. Initially, many relatives may think that these are just individual illnesses, but when these illnesses occur frequently or take an unusually long time to heal, it is often a sign that the immune system is severely weakened. Even antibiotics that were once effective quickly begin to lose their effectiveness, forcing patients to take stronger drugs, take longer treatments, and face more side effects. This weakened immune system is largely due to slowed blood flow and impaired organ function. When oxygen and nutrients are not delivered properly to tissues, the body cannot fight off disease as well as before. Another often overlooked problem is chronic wounds. If you notice small cuts, sores, or bruises that do not heal properly or keep coming back, it could be a sign that blood flow has been severely reduced. When blood cannot carry enough oxygen and nutrients to the skin and tissues, the healing process is significantly slowed. For those who are less mobile, pressure on the skin can lead to pressure ulcers, a dangerous complication if not controlled promptly, and can even lead to serious infections. What's more, infections in later life don't always present themselves in the way we expect. In young people, infections are often accompanied by high fevers and obvious symptoms, but in older people, the first signs may be just feeling tired, confused, or losing interest in eating. In fact, a sudden decline in awareness and alertness is often the first warning of a potential infection, even if other symptoms have not yet appeared. Therefore, observing small changes in the behavior and alertness of a loved one can help detect infections early, thereby providing appropriate interventions, ensuring they receive better care. For families, watching a loved one deal with repeated infections can be a heartbreaking and exhausting experience. As the illness worsens, it can be tempting to continue aggressive treatment, hoping that another round of antibiotics or another hospital stay will help your loved one recover. However, at some point, the focus of care shifts from curing the illness to ensuring comfort and peace, ensuring that the person is well hydrated, keeping the skin clean and moist, and minimizing stress on the body can be more beneficial than prolonging suffering with treatments that are no longer effective. Understanding this can not only help the person feel more at ease in their final days, but also help families prepare and make the most compassionate decisions for their loved one. If you're still following along, leave a comment to let me know you're here, and if you haven't subscribed yet, don't forget to follow and turn on notifications so you don't miss any useful content. Your support is the motivation for us to continue bringing valuable and inspiring information. Now, let's continue with the fifth sign. A noticeable change in breathing and circulation. One of the noticeable signs when the body enters the final stage is changes in breathing patterns. You may notice that your loved one begins to breathe more slowly, with shallow breaths or sometimes with unusual pauses between breaths. In some cases, breathing becomes irregular, sometimes fast, sometimes slow without a clear pattern. A common breathing pattern is Cheyne-Stokes breathing, where breathing alternates between fast, deep periods and long pauses. Initially, these changes may be difficult to notice, but over time, they will become more noticeable. In addition, poor blood circulation is also an important sign. The hands, feet, ears or nose may feel cold to the touch, and the skin may appear pale, bluish or even slightly scaly around the fingertips and toes. This happens when the body prioritizes blood flow to the vital organs, which means less blood flow to the extremities. The heart is no longer pumping as strongly, making it less efficient at delivering oxygen and nutrients. In addition, shortness of breath may occur even with small movements. Simple things like sitting up, changing positions or just talking can make them feel out of breath. You may notice them breathing through their mouth more often or needing to stop to catch their breath in the middle of a sentence. If they used to be able to move around the room easily but now have difficulty, their lungs may be failing. In some cases, fluid can build up in the lungs, making breathing more difficult. This can cause a persistent cough, wheezing, or a feeling of tightness in the chest. Don't dismiss this as just a cold. As for older adults who are in the final stages of their illness, this can be a sign that their lung function has significantly decreased. They may find it difficult to lie flat and may prefer to sleep propped up on pillows or in a recliner to make breathing easier. These changes can be worrying for loved ones, especially when they see them struggling to breathe. The first instinct is often to want to help them take deeper breaths or to panic that something is wrong. However, in many cases, this is a natural part of the body's decline. While these changes cannot be reversed, there are ways to help them feel more comfortable. Making sure the space is well ventilated, using a humidifier or simply giving them small sips of water can also help ease discomfort. Sometimes, in the final stages of life, it is important not to try to change or stop what is happening, but to create peace and comfort for your loved one. Some treatments may help with pain or breathing, but above all, this is a time to make them feel safe, loved and not alone. When you notice changes such as slower breathing, cold hands and feet or pale skin, remember that the body is gradually conserving energy, focusing on what is truly necessary. Your presence, gentle words and a quiet atmosphere are the most precious gifts at this time. Looking back at what we have shared, we can see that signs such as severe weight loss, prolonged exhaustion, cognitive decline, persistent infections, or changes in breathing and circulation are all warning signs of the final transition. They may come on gradually, not too clearly in the early days, but when they appear, they are reminders for us to prepare ourselves mentally, not to fear, but to cherish the remaining days together. Instead of fighting against the inevitable, we can focus on making this time meaningful. A handshake, a story told, or simply your presence can help them know they are not alone. This is a time to love more, to create moments of peace, and to tell them they are appreciated. If you are going through this with someone you love, take heart. Many have been through this journey before, and while no one can say it is an easy road, understanding can help you find strength, patience, and inner peace.